A lung cancer diagnosis used to mean a one-size-fits-all treatment approach, but today, science is changing that thanks to targeted therapies. These cutting-edge treatments are designed to attack lung cancer cells based off of specific genetic mutations. What does that mean? More precise treatment, fewer side effects, and better outcomes for many patients. It all starts with something called biomarker testing. This test helps doctors match the right therapy to the right patient. Here's a Lung Cancer Foundation of America educational video showing how targeted therapies are transforming lung cancer care.
Hi, I'm Jill Feldman. I'm a lung cancer patient and advocate. Thank you for joining us today on Hope with Answers. I'm here with Dr. Leighl to talk about targeted therapy.
Thank you so much, Jill. Please call me Natasha.
Okay, Natasha, thank you. So before we get into targeted therapy, can you explain what a biomarker is?
Sure. So in lung cancer, we use the word biomarker to talk about something within the tumor, whether it's a gene or a protein, that we can use to help plan the best therapy for people.
Okay, so when we talk about targeted therapy, what is the difference between targeted therapy and chemotherapy?
So targeted therapy is great. I think it's the best thing to happen in lung cancer, and what's really great about it is chemotherapy attacks all rapidly dividing cells, so cancer cells, but unfortunately normal cells, and that's how we get side effects. Targeted therapy, though, really focuses in on the cancer and really spares all of the normal cells, and so people have fewer side effects, but they still have great benefit, and that's what we really love about it.
That's great. So how do we know as patients if we qualify for targeted therapy?
So I think it's so important, if you are on the lung cancer journey, you really have to have so much trust and faith in your doctor and your medical team. So you really need to make sure that that relationship is solid, and your doctor needs to be able to help you with understanding the biomarkers, what has been looked for, what hasn't, what the possibilities are. Your doctor has to be able to explain to you what you have and why different treatments are best for you and what all the options are.
So how would a patient start that conversation then with their doctor?
So that's a great question. It's usually the first thing I start talking about when I meet someone who has lung cancer in my clinic. We talk a bit about the cancer itself. We talk about the different options. We talk about the biomarkers, what we know and we don't know. I talk about the standard options. And then we also talk more about some things that you might be worried about, that you've heard about, your own experiences, some things you might have read about on the internet, and then also where to go for more support. And then together, we hopefully come up with a treatment decision that's the best for you and really reflects your needs and gives us a great outcome, because that's what Hope in Lung Cancer is all about.
That is great information. Thank you so much for joining us today on Hope with Answers and talking about targeted therapy.
Thank you so much.
There's a saying at Lung Cancer Foundation of America that says anyone with lungs can get lung cancer, and that includes doctors. Dr. Sydney Barnard is an internal medicine doctor and a hospitalist in the oncology unit of Anne Arundel Medical Center in Annapolis. She's a never smoker. Sydney was diagnosed with stage 4 lung cancer in 2017, and thanks to targeted treatment, she's been NED, which means no evidence of disease, for several years, and she continues to run 5Ks. Take a look.
Hey guys, want to come with me on a run? All right, let's go.
In 2017, after a year of symptoms, I was diagnosed with stage 4 lung cancer. What alerted me that something was wrong was shortness of breath with my runs. I am so grateful for research, for treatments that allow me to still do things that I love. No chemo required.
Lung cancer didn't steal my spirit, and it definitely doesn't have to steal your breath. If you want to learn more, visit lcfamerica.org. Bye.